So welcome this afternoon to Compassionate Communities Together for Palliative Care. My name is Melody Jobsey. I am Community Engagement with the BC Centre for Palliative Care, and together with Stephanie Searle, who is in the background and a coordinator for hosting our ECHO sessions. On behalf of the BC Centre, we want to welcome you to this series in this session. So today, Wednesday, October the 11th, we will be hosting this ECHO series for 1 hour. And the two guests that we have today, we will be, I will give them a more robust invitation shortly, but Connie Stam, who is the coordinator for Compassionate Neighbourhood Health Partner Society, and Nancy McPhee, who's the coordinator for the Better at Home program on the Galiano Island, and that is through Galiano Health Care Society. I would like to, at this time, take a moment to just acknowledge, of course, that we are all actually operating and participating from various Indigenous communities and lands across British Columbia. On behalf of the BC Centre, though, I want to acknowledge the lands that we are working from, colonially known as New Westminster, located on the traditional, ancestral, and unceded territory of the Coast Salish people. And we recognize, as I've said, that all of us and all of you are participating from various traditional territories across the province, hosted and landed by other Indigenous peoples and their community. And so from coast to coast, we acknowledge these ancestral and unceded territories of the Inuit, the Métis, and First Nations people that call home. And I am grateful to be living and working and playing in these places and this land. So for some of you, I want to welcome you to perhaps what is your first ECHO series, and many of others may be very familiar with ECHO. So just a very brief introduction. ECHO is a short form acronym for Extension for Community Healthcare Outcomes. And ECHO is the venue or the platform by which we can spread knowledge across our healthcare systems and communities through the front line of cares. And ECHO's motto or its mandate is an all teach, all learn motto. So it is a model to connect content with context experts. So our ask of you is to share your experience and your stories. You are very much invited to participate in the discussion and the dialogue. So building connections with other participants in other disciplines across the geographical region is one of the primary connecting points of ECHO. And so after the presentations, we very much invite you to participate. And I would like to say, using the chat box, Stephanie or myself will be monitoring the chat box. And as we get to the dialogue or the interactive portion after each presentation, either the chat box or to raise your hand in order to participate, that would be amazing. At this time, we probably will not go into breakout groups, and we will probably remain as a joint group throughout the presentation and the dialogue. So the context for today is actually around what we call compassionate communities. And compassionate communities is a model, a public health approach to palliative care. This series is really lined up, or this offering today is really lined up with what you may know as World Hospice and Palliative Care Day hosts and creates an awareness day to highlight and draw attention to hospice and palliative care around the world globally. So on October the 14th, Compassionate Communities Together for Palliative Care, which is the theme for this year, is very much at the basic incorporation of the model of public health approach to palliative care. Because at the very basic, the idea of caring for people is a global concept. So this day, organized the Awareness Day by the World Hospice Palliative Care, is actually a charitable alliance to focus exclusively on raising awareness and the profile of the necessity for palliative care and hospice care by bringing together care that is given in derivatives from care communities. There are hundreds and hundreds of compassionate communities that have been developed in various forms of diversity around the world. So compassionate communities is very much a globally recognized approach to improving end-of-life experiences for people who are mobilizing, who are living in challenges of serious illness or end-of-life care, And compassionate communities are mobilizing networks locally, mobilizing groups and services to be more conscious, to be more aware of, to be more equipped, and to be more active in providing care and support to their communities. Why is this important? Well, the British Columbia, the BC Centre for Palliative Care, one of our mandates and our focuses that we delight in is to help community organizations foster care. And we do that by collaborating, partnering, and supporting with organizations like you represented on this call and those who will be presenting. And there is so much to learn. There's so much to understand about what other models look like. And in Canada, the compassionate community model is a movement that has definitely garnered a tremendous amount of support as well as greater awareness. And so provincially, we're also sharing this with you. Compassion, really, the next slide, please. Again, this is a profile from the World Hospice Palliative Care. Compassion is a foundation of healthy community, and everyone has a role to play to support each other through life. That premise, it matters, everyone matters, because you matter, this matters. Everyone has a role to play. And for the sake of this discussion, a compassionate community comes together to help support others experiencing serious illness, death, dying, bereavement support for everyone through kindness, compassion, and action. In order to provide a person or patient-centered approach for the patient and family-centered approach, this diagram just illustrates a number of diverse support and sectors that are represented. So from a person and their family, we have nurses and therapists, physicians, psychologists, pharmacists, chaplains, volunteers, home healthcare aides, social workers. It really forming a team around people in the community. And then the larger community, which is supported by social services that might include referral services, medical equipment suppliers, the government in the form of our Ministry of Health, health facilities, health insurance, and that list could be beyond what we see here. But categorically, we know that care is about improving the quality of life for people facing serious illness. And this is essentially what our compassionate community work is all around. Just the next slide, which is just a showcase of what is called the Venn diagram, reflecting that there is a vast number and a diverse number of compassionate communities around the world globally. And this Venn diagram is to showcase the overlapping circles, which around a charter of compassion. There are age friendship cities. There are dementia-friendly communities, and of course, compassionate communities. So this diagram that was depicting compassionate community relationships with other community action initiatives was co-developed by Pallium Canada, Hospice Palliative Care Ontario, and the BC Centre for Palliative Care. And it's just to showcase how other community action initiatives in Canada overlap. And when we have these compassionate initiatives overlapping, it offers and affords other opportunities to collaborate for a more significant impact and different forms and approaches. So with that in mind, I want to transition now to the next section, which is welcoming to this occasion, Connie Stam. And I will just, by words of a few words of introduction of Connie, pardon me. Connie is the coordinator of the Compassionate Neighbourhood Health Partners Society. It's a long word. It's a powerful title, but they refer to themselves as CNHPS. Connie spent most of her formative years growing up in the Chilliwack, British Columbia area, followed with professional career as a registered nurse. She completed her Bachelor's of Science at University of Victoria and received also a diploma of midwifery in England, after which she worked for nearly 18 years abroad, at first in Nigeria, West Africa, and then for more than 16 years in Bolivia, South America. She completed her nursing career in primary and community care, and is working now in the Chilliwack area with her CNA certification in palliative care and gerontology. She is one of the founding members of this organization, Compassionate Neighbourhood Health Partners Society, and was recently incorporated as a society in 2017. So welcome, Connie. We're happy to have you. I invite you to begin to share the work that CNHPS is doing.
Thank you, Melody, and good afternoon to everyone. It's a pleasure to me to share our different programs with you, and we hope we'll have questions for us to be able to expand further. But just on briefly, as Melody mentioned, we were incorporated in June 21st, 2017, so we're 6 years old, and our vision and mission have evolved in that time, and we're presently working on our next 3-year strategic plan, which includes our new vision and mission statement. So next slide. The vision of CNHPS is that every older adult will feel emotionally and psychosocially supported in his or her neighborhood. For this presentation, I will be discussing with you the different compassionate community programs that CNHPS offers in the Chilliwack community, together with some anecdotes, why we had started these programs, and how they have evolved to the present day offerings. All programs and opportunities are available to any older Chilliwack adult and or their caregiver free of charge. Next slide. So our first program was offering one-on-one support for older adults living with a serious illness. Besides the emotional support, the volunteer was a second pair of ears at doctor's appointments, taking notes of the conversation, and could help with mentoring in advanced care planning and healthcare system navigation. Just one anecdote from Linda, a 62-year-old lady who lived on her own in Chilliwack and suddenly started a serious cancer journey. Her son worked full-time and lived in Vancouver. Her elderly mom lived in Ontario, and her best friend lived in Iowa. So she had no one to be that second pair of ears. Volunteer with a healthcare background would go with her to the oncology, and she had very serious, she ended up actually passing away during that volunteer's time with her, but she could take those facts, those notes that that volunteer made, that she had reviewed with her, and send it to her loved ones throughout the world, and they felt like they were on that journey with her. And so she felt that she wasn't making these decisions on her own. So besides the emotional, there was also that part of the program that was very valued by those that participated in the program. I'm hoping that there's other areas that are doing this, because I just got last week a call from a lady in Vancouver asking for this type of help. So if there's someone on the call who is from Vancouver who would be able to help me find a connection for her, that would be wonderful. We didn't stay at that. We also went further, and we also have the one-on-one friendly chats with a lonely senior. And so you have here on the slide, the first one there, we have pictured for you, Lawrence, who's the volunteer who visits Nelson. Nelson lives with total blindness. He's in his 50s. He's in a supportive housing. He does have supportive sisters, but they don't have that much time. They work. And so this is a very special, adds special quality to his life, that Lawrence comes and has fun with him. And he has that to look forward every week. The middle one is Colleen. She's 90. She also lives with legal blindness, and she is also on a palliative journey. And she said, my family just doesn't have time to listen to me. And so Haley, she is actually starting her master's in geriatric psychology. And she says, she calls her Nana, and she said, she's such a wonderful listener. She says, I've got all these things I have in my head, and I could just bring it. And she just nods her head and just is that support for her. And the last one there, you see Greg visiting Brian. Brian is a double amputee, and he also had a major stroke in which he became aphasic. So he's, difficult bringing his thoughts out. But they made an amazing connection. Greg's going in for physiotherapy. He's been now for 2 years connecting with Brian. And this is actually Brian's birthday party that Greg set up for him. And so you see that these connections by volunteers makes a huge difference in the lives of these older adults. Next slide. So next program, I've got this backwards, but anyways, the Seniors Connect Cafe, we have started up in 2018, and it was modeled after the talking cafes in England. And that's where they were saying, like socializing and signposting to resources for older adults. Well, we have evolved further. We started this program because in our open forum, when we were seeing the importance of whether we should become a society, 3 of those older adults had told us, Chilliwack is a difficult community to break into. And so this is where we based it on. We started with 8 people. We presently have 40 to 60 coming to the non-luncheon events and up to 80. We had 81 last week coming to a luncheon event. What do we do at these activities? We have information that's of value to our seniors. So they actually participate in a survey to tell us what are the areas that they want more information on. But we also focus on those seniors that are having difficulty leaving their homes. So we get a lot of referrals from health professionals and from the social prescribing program. And we provide that initial taxi service until we can get them complete their handy dart paperwork and get them onto that program. So an anecdote from June, she uses a mobility aid. She never drove. Her husband died for a whole year. The only thing she would get out of her house for is if she had a medical appointment and someone could bring her there. So through this, she said, my life has changed so much. I now, have new friends. I have something to look forward to. And I could give you many more anecdotes, but I won't take the time for that now. So what do? We have an activity calendar every Thursday. We have 1.5 to 2 hours together in which there is a presentation part, and some of that is also older adult show and tell. They have a wealth to be able to share, and so they, share from their background, but we also have various presenters bringing in information that is of value. In the summertime, as you notice in the lower picture, we would take advantage of a local park so that we can be in nature. We know how nature can help for us in our mood. We have people with, as we mentioned, mobility problems, with physical challenges, such as several of them living with blindness, obviously the hearing aids problems, but we also have those with mental health challenges and some with developmental challenges, all joining us for these activities. Everybody is welcome. And the last picture you see for Canada Day, we also had a sing-along, and they really enjoyed that too. So just a few anecdotes about the Seniors Connect Cafe. Can I see the next picture? And so neighborhood connections, that's actually the foundation of our programs, is having compassionate neighborhoods. This here is a picture of the last workshop series we did, and they provide a certificate. We provide a certificate of completion. The two that are on the left, they actually wrote an anecdote, but I don't really have the time to tell you about it, but they're testimonial of the value of our workshops. And the lower one is a Neighborhood Connectors Planning Committee. She was planning their barbecue for this coming year. So connecting in the neighborhoods, when we know each other, it's a safer neighborhood, but it's also a healthier neighborhood. And that's what we try to promote through these workshops. And some of you might say, well, what do you actually teach in the workshops? So I just wanted to shortly say that we have 5 3-hour workshops. The first one, of course, is what is the compassionate community movement. We also look at the asset-based community development model from John Knight. You know how John Knight says famously, are you a neighbor or do you just live there? And that for me spoke to me when I started working in my own neighborhood as a volunteer. And so we're looking at that, but of course, included with that is your confidentiality. They have to be able to trust that they can share these things without it going further. And we have to look at setting our boundaries. So that's our first workshop. We don't want to be overwhelmed by our volunteering that we're doing. And then in our second workshop, we're going to be looking more at building those trusting relationships and what is the function of a connector. It's not that you do all the work. You're connecting your neighbors and you're, learning their assets and learning what are the gifts that other neighbors can give and that you can connect. And one small anecdote, in our neighborhood, Mary, she has 1 daughter and 1 grandson living in a condo in Surrey. She loves her dog. She had to go to hospital, and we know as healthcare professionals how challenging that can be for a senior if you have a pet and you don't think there's anybody to look after it. So as a connected neighborhood, there was no problem for another neighbor to care for that pet while she received the care she needed. second workshop would be, as I mentioned, about building that trusting, knowing the importance of our nonverbal communication, just again, making ourselves aware that how those 93% of our in-person communication is actually nonverbal. And the third one would highlight, the active listening skills and looking also at how do I communicate with someone who is hard of hearing or lives with vision loss or is on that dementia journey. And then we would, on the fourth one, highlight all these challenges that our neighbors could be facing. They could be personal or family challenges. It could be that I'm caregiving, I'm burdened down with that, I'm grieving. And, if I'm overwhelmed, how can I try to work on all things with a brief action plan? So that's what's part of the teaching. And then for the fifth workshop, we're looking at the red flags of older adult abuse, and also if someone's on a serious illness journey, how can you support them in looking at doing an advanced care plan? So we do hands-on introduction to advanced care planning. And as people become neighborhood connectors, they do not have to be that for taking this course, because even through it, as the two that gave their testimonials, it helps you in your everyday. It helps you with your, reaching out to other older adults in your networks. And those that are, we also have the availability to come together to share your successes and your challenges. Next slide. So our next program is our Family Caregiver Support Group. It was started during our famous COVID lockdown time. We started in 2020 just because of the extra burdens for caregivers, and there was nothing in Chilliwack. There was for Alzheimer's, but not for others. And so we have a group of about 18 caregivers coming together, and they are just going to read one of the anecdotes. I think that's the easiest for it. So that's Shirley, and she says, serving as a family caregiver, whether during a health crisis or chronic illness, is a magnificent act of love. But caregiving can also be relentless, isolating, and sometimes scary to have so much responsibility. My husband was diagnosed with Parkinson's in 2017. Stress affects so much of our health, and I noticed a gradual increase in my husband's symptoms. I talked to my doctor about it, and he said I needed a plan going forward. I kind of had a plan in my head, but realized I had a lot of questions and didn't know who to ask. I attended the first Family Caregiver Support Group meeting and immediately felt welcomed. These ladies all have their journeys. They were all handling stress and had lots of advice. I love this group because I've learned so much from just listening. I have heard so many good suggestions that I never even thought about. When you are a caregiver, you feel so isolated, but this group made me feel like we were all in it together. I love the fact that we all laugh together and cry together. They understand. And so this is a group that meets every Thursday afternoon and for an hour and a half. And then we do have once a month on a Monday evening for those that cannot attend this one. Next slide. Intergenerational program also started with our famous COVID lockdown because both youth and seniors had a difficulty connecting during this time. And this actually comes, we are a connected community, Chilliwack, and because I already was using some university students, they said, can you take this on? Where we would have the youth. So we had 47 youth connected with 53 seniors. Of course, once the activities became more normal, we had less youth coming to join us, but we're happy we're still getting between 10 and 20 who also share in their anecdotes, in their testimonials, the value of this program for them. Mm-hmm. What do we do in these events? They're twice a month and they're on a Monday afternoon. Besides the themed chats we have together, we do crafts, as you have seen a previous one of painting. We also have here one of beads, another one of origami, and we do board games together. So that's another opportunity for those seniors that don't have much connection with youth to come together. And we do also have recently had a young person come up with the idea of doing cooking classes together. And so we had a pilot and it was a huge success. So we hope next year to also incorporate that twice a month, knowing how important nutrition is too. And how often seniors can be just living off of the famous toast and jam. And this will help them to have different ideas of what they can prepare. Next slide. And so lastly, we have a 9-month pilot project that, thanks to BC Centre for Palliative Care, that we could initiate this to try it out, because we had heard that there is seniors that have absolutely no network of support in the community. And when they've been in hospital, they come home and there's nobody to check in on them. And especially we found was a lot of value for these seniors is to have someone who brings a warm meal initially and some basic staples of food, especially if you've been a number of weeks or even months in hospital. And so that's been a very successful part of that program. They might be overwhelmed initially with the calls they receive about other tests and other things that need to happen, but this part was especially helpful. But we also have, I'm going to end with one more anecdote. I hope I have still time.
Yes.
Hardly, probably. But yeah, I'm good. So this was a person who was totally isolated. He only had his ex-wife that he had connections with, and he was now in his last weeks of life, and he did not want to go to hospice. So they connected them with our volunteers. And well, obviously it was not a successful return home. That was just overwhelming. How are you going to handle this person if you don't have more than the few volunteers? But they had a special connection with him. And he was originally from a Catholic background, and they were able to help him receive that visit from a priest and to have that peacefulness. His ex-wife did remain involved in it and was so appreciative to have these extra people to help through those final weeks. So we will be ending in mid-December, and then, taking stock of, where could improvements be made. We're doing this ongoing, but we do see the value, especially of the nutritional aspect of this program. Thank you. Last slide, look forward to the questions you may have.
Wow. Thank you so much, Connie, for the amazing, short, intensely packed overview of the work that the community is doing there. I would like to open the floor. If you have a comment or a question, you're free to post it into the chat. Or actually, I can start while some of you may be thinking. I just want to ask the question, developing 5 various streams right now, Connie, and the work that has been delivered and the services that are provided, what are some of the pinch points of learning and growing to serve the community that you've experienced?
Well, I think one of the things, as you know, it's challenging as you expand, and sometimes I'd have to be very honest, to keep your board on board with you as you're going forward is one of the pinch points, is, having the fully engaged board members that are also, supporting you in this journey. Obviously, it's also maintaining your volunteers. I have a wonderful group of core volunteers, but there's also many that for various reasons, even health reasons, have to then step away, and getting new volunteers back on, right? And so right now we're actually looking at and the funding part, so getting the funding to be able to do the operational. We can get funding for the projects, but it's the operational part, right? That can be a real stressing point.
Diana?
Yes, thank you.
Sky, go ahead.
Wonderful presentation and so much that you share. Thank you. I'm curious if you have some strategic partners in your community, and I'm thinking to the other speaker from Better at Home, or even your hospice organizations or community care, your public, like Fraser Health, I guess it would be, the nursing. And I just wonder, how are those relationships managed, or do they support you in any way?
Thank you for that question, because yes, we are a very connected community. We have what we call the Healthier Community Network, and under that we have the Healthy Aging Subcommittee. So all those organizations that work with older adults, once a month we get together, like a round table, to discuss about what are the gaps and what are the areas where we need to work further. And so we have here in Chilliwack the Chilliwack Senior Resources Society. Their focus is on the the bus tours and doing the activities, the physical activities. We do have the hospice, and of course, they're looking at the grief counseling. They're looking at the Hospice Society, the work in the hospice in Chilliwack with their volunteers. And then we have our peer counselors, and they're doing the longer term one-on-one, but they're overwhelmed. So, having others help with that one-on-one, because there's so much need, and it keeps increasing with our aging population. And yes, our Chilliwack community, primary community care, of course, I have the advantage that I worked there before I retired, but they definitely are part of our referral, and the older adult mental health send referrals to the community. And they also do presentations for our organization. So yes, we do have quite a bit of connections throughout our community.
Thank you. Anyone else have a question or a comment? You can unmute yourself and go ahead.
Just a quick fabulous programs. Just a quick question about the number of staff and number of volunteers that optimally would support it.
So I wish I could say that we had staff. I am the only part-time contracted person, and we are presently looking at expanding that and seeking that funding for that. So volunteer-wise, we have about 40 volunteers, but half of that would be the one-on-ones, right, that are doing that activity. And then we have that core, probably more like 15 that are for the in-person things. And I just wanted to mention that, I'm a volunteer most of the time, right? I'm a part-time contracted, but I'm a strong volunteer.
So what this really models is, once again, where the needs are established and community come together, there's this momentum, in a sense, a grassroots, a set of actions in order to meet the needs of what we see and what you see in the community. And yet out of this, hopefully the growth would help establish you with finances, with funding, with a more stable staffing model that would allow you to continue to grow, because we all know what burnout looks like, and we don't want that either.
Right.
Okay. Thank you so much, Connie. We are going to move ahead now and allow our next participant to present, and after which there will also be some dialogue opportunity for questions with Nancy. So by way of introduction, I'd like to introduce you, Nancy. Nancy McPhee has been, for over 30 years, has worked as an adult educator and facilitator and coach, and an associate faculty, with the Center for Conflict Resolutions at the Justice Institute of BC. And that was affiliated with a consulting group and a private practice. So Nancy has her BA in leadership from Royal Roads University and has lived on Galiano Island for past 24 years. So is now, as she says, kind of retired, working part-time with the Galiano Health Care Society as a coordinator of community wellness. Alongside her life on the island, she is an artist, a gardener, and an island lover, I think, of living on the island. So welcome, Nancy. I invite you to share your program with us and the work that you're doing.
Thanks very much, Melody. I must just thank Melody for putting the map on my slide, because I was just going to explain to you where we are, but this really gives you a good visual. We often, people from Vancouver, Richmond area look at Galiano probably daily and don't realize what an extraordinary little community it is, as are the other Southern Gulf Islands here. We have a population of approximately 1,400 full-time residents, which expands to 4,000 or 5,000 in the summer. Lots of visitors and summer people and weekend people who come. The clinic, which has been operating for over 25 years now, really has capacity only to treat urgent and emergent cases for our visitors. And we have 2 doctors and a nurse practitioner that work here, plus a community health nurse. We have a social worker who's doing mental health outreach. We have a counselor who's part of the Salt Spring Island Community Services Organization who works part-time here at the clinic. We have a lab every Thursday morning. Island Health send a lab over. And we have allied health professionals as well. We have a dentist who comes on Wednesdays. We have a foot nurse who does foot care, massage therapist, physiotherapist, a chiropractor, lots of people who are cycling through the clinic who aren't maybe based here, but provide services to our residents. The curious thing about Galiano is that of our population, probably 55% of our population is over 55 years of age. So we have a lot of seniors. And what's also really interesting about Galiano, this is my own personal opinion, is that people who move here tend to be either very independent minded and don't want to have anything to do with anybody else. They've moved because they have they garden, they are artists, or they're just independent minded, and they are not joiners. And then there's a large group of people who are also seniors, who are retired, who are committed volunteers. We have over 35 organizations on the island that are nonprofit, and they are all run by boards of directors. And there's very often one person will be on multiple boards. So there's lots of community involvement. When I started here at the health center, I was hired to set up a seniors recreation program, and was met by extraordinary resistance. I was quite surprised, actually. People said, "Don't organize us. We can do our own organizing. Thank you very much." So I was sort of set back on my heels, and anyway, ran a conversation cafe at the end of my funding. I had 3 months funding for that little program. And all of a sudden people got engaged because there was over 60 people that attended. Everybody got kind of excited about what the possibilities were in our community. And that's really when I got started working on developing a program for aging in place here. How are we going to age in place here on Galiano? So Stephanie, if we could have the next slide, I think that might. There we go. So community wellness emerged a couple of years ago because I was doing more and more work with different kinds of programs. Better at Home has been really a godsend to our community. The United Way gets funding from the Ministry of Health, and I think they're probably over $60 million a year now. There's over 97 Better at Home programs throughout the province. And the rural and remote programs are kind of unique because we don't have access to lots of services that you would find in an urban setting. And so we have been really fortunate with the funding that we got from the United Way to run our Better at Home program, to provide subsidized or free light housekeeping services to people. We provide transportation if they need to get to a medical appointment here on the island. Off-island transportation is a whole other question, which I won't even start. It's very difficult to find people to volunteer to take folks off the island because it's a 12-hour day pretty much. But we are, when COVID came, it going to link down to food security now. We have a very active Galiano food program, which is run by a nonprofit society, the Galiano Club, which is over 100 years old on the island. And we immediately started delivering frozen meals and frozen soup to people. And we were actually ahead of the game with the community-based social services that were started and in response to COVID. You know, it took a while for some organizations to kind of get all these food supports, grocery shopping supports implemented. And I was quite surprised how easily we were able to pivot. And I think this really speaks to the idea of a compassionate community. Because we're so small, we rely on each other, and we know each other. And so, you know, it just takes a phone call to say, okay, what are we going to do and how are we going to do this? And all of a sudden it's beginning to happen. So the Better at Home program, which is doing housekeeping and gardening, and it's an entryway into connecting with seniors who are isolated, elderly, or frail is not probably the right word to use, but they're losing their ability to garden as much, to get up and down stairs as much. They've lost their driver's license, they can't drive. And when you can't drive in a community like ours, unless you live beside the store, it's distance is always a challenge. And we have no taxis, and we have no bus yet on the island. I did a survey a couple of years ago, and I said, what do you think about island transportation? Would you like to have a bus? And oh, what a great idea. And then the second question was, would you use it? No, I'm fine. I've got a car. So even people like the idea, the fact that they're not going to stand out there on the road. Although I think, hitchhiking is not such a difficult thing to do on the island. And there are some lifelong hitchhikers out there, and you see all sorts of people standing with their hand out and usually get rides. So the food security thing has become a big deal for us. We received money through Better at Home last year, which is funding us through till March, I think, to subsidize meals that are paid that people, because we continued the meal delivery program after COVID restrictions eased. And it's a real for somebody who's having difficulty standing, or just someone who's, I don't know if there's how many old people we have in our listening group here, but sometimes you just don't feel like cooking dinner. And it's very nice to have a well-balanced, nutritionally well-balanced frozen meal or a frozen container of soup in your freezer, so that you can just take it out, either pop it in the microwave or heat it up in a different way, however you want to do that. And it's been a godsend for lots of people. So we've been able to subsidize people who are on limited incomes, or we're providing them full service subsidy for Better at Home. We've been able to provide them with meals, and they've been truly grateful. It's been an extraordinary, if you think, if you get 4 meals a week at $7 a meal, and you get them every week, and you're on a pension, that's a lot of money to be putting out for meals. So in terms of just compassion, we a few years ago, we were thinking about aging in place and how do you do that? And people were really, they didn't know, well, they still were very resistant to talking about death and dying. But we do advanced care plannings. The coordinator of the Transitions in Grieving and Dying program, well, co-lead with me. We do the advanced care planning workshops here on the island. And it's really quite surprising how little people know, and how afraid they are to talk with their family about what their wishes are, or their friends. And, haven't really even thought about DNR, or talking with the doctor about medical orders for scope of treatment, or it really lacking a lot of information. So we ran one last Thursday, actually, and we had 12 people attend, which is huge for our group and for the island here. It was really quite wonderful to see that kind of support. What also was really helpful is our community health nurse was there. And she realized, listening to all these people, how little people know about what you can do to get a representative agreement in place, or what you can do to get your finances in order. And even simple things like, how do you deal with getting your cat organized, or whatever. Just have to plug my computer in here. There we go. So lots of information sharing here in our office. The Transitions in Grieving and Dying program started about 2007 with a couple of people on the island, and it's been handed over to Linda Zingaro and I to run. And we run grief groups, and we do bereavement counseling, or just talk on the phone. I don't know if it's counseling per se, but it is. But it's sometimes people have no one to talk to. about somebody who's died, and it may be death, but it may be their husband is slipped into dementia, and the person they loved and were married to for 46 years, 52 years is gone. I mean, they're there, but they're not there. Or they've had a medical emergency of some sort and someone's had to leave the island, which has really just spurred us to consider developing a home hospice program. And I think that we have been extremely fortunate to get some seed funding from the BC Centre for Palliative Care. And we start our first volunteer hospice training program in end of October. And we are really thrilled about that because it's going to fill lots of gaps that we see happening here on the island. Let's have the next slide and see what I'm missing to talk about. Oh, there we go. This is all the stuff that I've told you about already. So I think what we're really trying to do here, I'm speaking to at the point down here about responding to individual needs. All of us are really aware that there are people who have, everybody's unique and everybody has their own worries and concerns. And so whether it's going into clean for somebody, or whether it's taking them to a medical appointment, or whether it's meeting them in the store and all of a sudden they're in tears about something, all of us are responding to each other with care and compassion and recognition. This is a valued member of our community, and we all, one for all for one. That's us, right? So home hospice, it will be up and running hopefully in the new year. And we are just starting our relationship with NAV Care, which will really focus on people with life-limiting illnesses, and as they segue into a more intense kind of palliative care situation. So, and let's go to the next slide here and see. I've got to stop talking. There we go. This one's what makes us compassionate. One of the things I think that really helps for us here is that we are interested in each other, but boy, do we work together to get things done. And that certainly happened here at the health center. I'm astonished from when I started 14 years ago, what we now are doing here at the health center. And it's amazing how many people will call me and say, so-and-so needs some help. Could you give them a call? I'm going this afternoon to be with some people because, there's somebody who's slipping away with Alzheimer's. And so how do we create time to be together? How do we create time to be alone? How do we give people time and space to contemplate? How do we build those places for companionship? And how do we keep ourselves buoyant by incorporating laughter and fun into our lives? So we don't have a seniors center. We don't have seniors daycare. We have the food program, run a soup and bread program every Monday, so everybody can get together for that. We have the clinic here runs a program we call Chatterbox, which is a coffee and tea program that runs on Tuesdays. We have osteofit classes. We have a theater group. We've got a choral society. We've got, the list goes on and on and on. So I think what makes us a compassionate community is that fact that we're interested in each other as people. We're interested in each other as entertainers, as well as the rich, complex human beings we really are. So I'm also going to just give a plug to the other islands here on the island, in the Sailor Sea. Better at Home also runs on Saturna Island, which is much smaller than we are. I think there's only about 400 people that live there full time. Pender Island also has a Better at Home program, and they're as involved as we are, as Saturna is in doing all these different things. And Salt Spring Island, which is the big island in our group, there's over 10,000 people that live. Well, I think it's more like 14,000 people that live on Salt Spring now. But they do run a Better at Home program there as well. So I think this idea of working
Wow.
together, it makes us successful.
Yeah.
So I'll just stop right there. I'm sure it's out of time. And there we are.
Thank you. Thank you so much, Nancy. What a diverse and multi-prong approach to care in a community such as Galiano. I would invite anyone now who has a question or comment or an inquiry about what else would you like to know about, please raise your hand or just jump in right now if you would. I think as you're maybe still thinking, one of the pinch points, I guess, that I've asked of Connie as well as the pinch points of learning and growing would be some of the obvious limitations, like you said. Half of the population on the island is an actual older population, older demographic, and the limits of time and or even resources is a limitation, but volunteerism is significant. So it's very interesting to see the difference in communities, and the fact that you are, so to speak, limited to the island. It's intentional to get off. It means that you're invested in your community in some capacity or another. So very different as opposed to in Chilliwack, where the intention is to recruit and find volunteers who want to be involved in their community, who know somebody. But again, volunteers drive the compassionate community movement, and I think I see that really clearly here.
Well, I think it does certainly in our community. Volunteers really drive all the well, because of the organizations that we have that do all these different things. So there's a fine line, though, I think, and I think there's a volunteer fatigue that occurs, and I have to be really mindful of asking too much of people who might be volunteering, because I think that working with our clients is not easy. Right. And so it's a challenge. So our Better Home service providers, I have 3 people that work for us, and they're all paid staff. They work part-time for the healthcare center, for the society.
I have a question. Cynthia, go ahead.
Hi there. Hi, everybody. Very nice presentation. I live in Montreal, Quebec, and I am part of the NAV Care program. Actually, I'm the coordinator for our area.
Great.
And and it's a wonderful program. And I found what you just said curious, because I see that, because I understand about volunteer fatigue, and we have to be very appreciative of our volunteers and their time and their precious time that they give, and not to overtax them. But I was taking notes and looking at, comparing a big city like Vancouver or Montreal to a small rural area or an island, such different challenges. And I think I'm just wondering, do you find, because your community is so small, that volunteers you might see more volunteer fatigue, because those people in a small community, like you said, who all know each other, who all, are connected, it's very hard to get away, in a sense, or to say, no, I don't have time, or I can't do that, or I need time for myself. Whereas for us, it's, yes, we do have those challenges, but I think in a very different way, because people don't know each other in a big city. Right. So it's interesting what you say. And I wonder how is that something that comes up, that people just almost because they know each other, is there a feeling that you're obligated as opposed to wanting to give, or does that become a problem for certain people?
Well, I think, Cynthia, there will always be people who will volunteer because their heart is there and heart is in it. And so we are going to offer the NAV Care training to our hospice volunteers, and we will probably recruit a couple of other people. Because quite honestly, of a population of 1,400 people, we might have 10, 12 deaths a year here on the island, like not very many people. So in terms of end of life palliative care, we're looking at the months before you get to end of life palliative care. We're looking at a much longer period of time. So I think that the NAF care services will be using volunteers for those as those roles as well. But you're very correct in saying the challenges in a small community is that not only do you know each other, or you might know the person's name, but you run into them in the hardware store.
Right.
And you run into them at the garage, and you sit beside them at the at the theater thing that they're putting on. And I think that for some people, particularly the doctors here on the island, you run into your doctor in the grocery store and you think, oh, can I just ask you?
Oh, geez.
No, you can't actually. People come and ask me, oh, can I just ask you? Or they're shouting across the road, you see you at wherever. And I say, no, I'm not working today. Call me I won't remember. Well, call the office and leave a message and I'll call you on Tuesday, because I only work 2 days a week. And I have this reputation of being somebody who knows everything, which is kind of annoying. But anyway, I can link people into different things, right?
Mhm.
But it is a big challenge, because I'll just tag this on here. The issue of confidentiality and setting boundaries is huge.
Yeah.
Because you don't think you're breaching confidentiality, but even just somebody seeing your car with somebody else in it, they go, oh, isn't that interesting? So-and-so is with Nancy. So, it does present different challenges. So, I mean, with our Better at Home staff, the service providers, and the volunteers, I mean, we are on confidentiality all the time. It's like, you don't say anything to anybody. You don't talk to your spouse, your partner, your neighbor, your mother, even if she lives in Calgary, you don't tell your mother, because 6 degrees of separation is not very far.
Very true. It's
very alarming to think, oh, well, I'll just casually mention this to somebody else, and they go, oh, that's my aunt, or my cousin is married to her sister-in-law, whatever it happens to be.
That's such
There's
a
always a
different
connection.
perspective, isn't it? It's a very wide open, the perspective that you just showcased is, for the most of us, not really the reality. The 6 degree separation is my neighbor next door. We'd have to work really hard to figure out who's who.
Yeah.
Very different challenge there.
Yeah. And, going along with that, everybody likes to know everybody's business. And even though we like to think that, oh, I'm just sharing out of concern and compassion.
Right.
No, don't share. It's not your life you're sharing here. So, it's a challenge. And, we have some of the most amazing people. Wonderful, we have an ambulance, and we have a fire department. We have 2 fire departments, actually. So we've got, and community paramedics. I mean, we are in many ways well serviced. So it's really important for us to be able to zip our lips and keep quiet, because people know a lot of information.
Yeah. Very interesting differences, and interesting the difference between the challenges that each face. Thank you very much.
Thank you, Cynthia.
Well, I have a sense we could talk lots more and learn much more from each other if we had a little more time. I would like to respect the time and be very mindful. First of all, thank you so much, both Connie and Nancy, for the insightful presentation to the very multi-pronged approach work that you're doing in your communities. And there's much to learn and much to glean and much to partner with. So I invite anyone who's on this call, if you'd like more information, Stephanie will be sending you this PowerPoint deck with the links to the community providers, and we invite you to follow up and pursue further conversations beyond this. I just want to give you the invitation to explore more of some of the community resources that the BC Centre for Palliative Care has. And so in this document that you will have, this page around compassionate community resources is a live link. You can jump on that webpage yourself. And we just also invite you, if you're not already subscribed to Centerpoint, it's a once a month e-newsletter from the center that showcases community work, education, partnerships, the next ECHO series. Please do so. You can subscribe on your own. That's also a live link. I want to tell you about the next 2 offerings that the ECHO session will be hosting. Is one in November and one in December. Next slide, please. So in November, we will be hosting ECHO series, the ECHO session called Prescriptions Beyond the Pharmacy, Social Prescribing Approach to Wellness. And in December, we will be hosting DEMScape is a short word, but it's Developing Dementia Inclusive Spaces for Community Access, Participation, and Engagement. And you will find those on the registration links in there, and you can jump on and register for it. It will be in our center points coming up as well. Just want to let you know about that. And again, to let you know that the Palliative Care ECHO project is a 5-year national initiative to cultivate communities of practice and establish continuous professional development among healthcare providers in Canada who care for patients living with life-limiting illnesses. So you will receive an email following this from Stephanie. As I said, it will also have a survey link. We are very important. It's very important for us to hear from you. You will find this link in the chat. If you have a few moments to just pop into that and fill in the evaluation, we appreciate that. We are always looking for further information to improve and or add other topics. And your participation in that is really crucial. We really appreciate it. And last but not least, thank you for your participation. And thank you to Palliative Care ECHO project that is supported by a financial contribution from Health Canada. And none of this would be possible, of course, as we all know, without our financial partners, our community partners, and our practitioners like you who are on the ground living and doing the hard work. Thank you so much. We cheer you. We're advocates. You are the Compassionate Communities champions. Thank you for the work that you do. And thanks for this time. Have a really great day. I'll stay online if anybody has a few questions. Otherwise, thanks. Have a great day.